As Danielle said, I'm Catherine Donahue, and I'm a clinical social worker, and I am also the case manager at University Counseling Service. For my portion here, I'd like to talk with you about all of the on-campus mental health resources that you see there. So I do want to talk about University Counseling Service. That is the agency that I work at. And it is the primary counseling service agency on campus for students. Second on the list will be Student Health and Wellness, and then our Seashore Clinic, and finally the Women's Resource and Action Center. So I'm going to begin with University Counseling Service. We offer a variety of services at our agency, and it is we solely see currently enrolled students. Some of the other agencies that I will talk about actually serve members of the community in addition to students at the University of Iowa. But University Counseling Service is totally focused on serving students. So the range of services that we provide, we offer consultation. So anyone just wanting to come in for 1 or 2, 3 appointments, they can do that anytime they feel the need. Then we offer also individual counseling. That's probably the core of the services that we offer. We offer brief therapy only, and that way we can serve a larger number of students. We also offer couples counseling where both partners are currently enrolled at the University of Iowa. We have a number of therapy groups that occur each semester. We do a lot of outreach across campus, and just programs going all the time. We are a training agency for future psychologists, and so we do offer training, and we also have a student advisory board. And so I will have you advance the next slide. I want to talk about our group therapy, and here we've got a list of some of the groups that are typically offered. So we've got the acceptance and commitment therapy group, which is really wonderful for things like anxiety. It takes a kind of a mindfulness approach. Eating issues, a body image group, and then just a general therapy group, men's group, women's group, again, another mindfulness group for anxiety and depression. Our Social Skills 101 group is really designed for students on the autism spectrum, and Dr. Kathy Staley at our agency is the contact person. So that's the variety of groups that we typically do offer. And here we are. And so UCS is comprised of 12 psychologists and 1 licensed independent social worker, myself. We have 3 graduate student interns and practicum students. And so we do have staff profiles on our website, so you're welcome to go on our website and take a look. And certainly each staff really has an area of special interest in areas that they specialize in. We are located on the west side of campus across the river, actually across from the Iowa Memorial Union. Wanted to talk with you about appointments. We do require that students make their own appointments. We just view this as an invitation for students to begin to take a role in their own self-care, and so we do require students make their own appointments. You certainly, others can assist a student, but the student actually has to speak on the phone and make their own appointment. I did want to talk about referrals, and this is really kind of the area that I work mostly in. And so when a student's mental health needs extend outside the brief therapy format or brief therapy scope of our agency, or if a student might require a higher level of treatment, then often I am involved in that. And that can include if a student really, we need to get them to the emergency room, then we assist with that. Also, I can assist students with referrals to an intensive outpatient treatment program. Oftentimes, students look at that option between semesters. Also, a good number of students really want or need are looking for counseling, working with an individual counselor for ongoing or longer term counseling with a community-based therapist. So I assist them with that. Also, I help with finding a psychiatrist off campus if a student wishes to do that. And then also assisting students with finding a psychologist in the community for psychological and learning disability testing. But when I meet with students individually, I take a look at their insurance. We contact insurance together to look at the level of coverage and what the student will be responsible for financially so that there are no surprises for them and to assure that they can afford this. And so then I also, we ask for a list of in-network providers here in Iowa City. Good portion of my job is to know our therapists in this community. We have a well over 100 therapists in private practice in this community. We've got really a fantastic blend of psychologists, clinical social workers, licensed mental health counselors, licensed marriage and family therapists. So I also really work with students to find the best therapist match for them. And so that's a large part of my role. I just want to note that all enrolled students at the University of Iowa are required to have health insurance that can be used in the state of Iowa. And just note, if that's an issue, the university does offer a student health insurance plan. It's called CHIP. It's a wonderful Blue Cross and Blue Shield policy. The premium is $140 a month. And in terms of counseling, mental health counseling, students would just pay a $10 copay per session with no limit on the number of sessions. I did want to talk about our student health and wellness, and they are located in the same building as the University Counseling Service, but they are a separate agency. And so at Student Health, there are two psychiatrists there, Dr. Joy Hudson and Dr. Paul Natbig. And if a student is enrolled and has paid their health fee, then they really can access those psychiatry services free of charge. And so it's a wonderful service for students who come to college already on some sort of psychiatric medication, and if they would like to have those medications managed here locally while they are a student. Student Health also has an eating disorder specialist there, Dr. Kathy Wittich. And then you see there the link for, or how are you feeling? And so Student Health has a online self-assessment where students can really do a mental health self-assessment and then seek care appropriately. And I did want to talk about the Seashore Clinic. This is an awesome place on campus and also another place where students can get mental health counseling. It is run by the psychology department here, and so for any students that would be interested in seeking mental health counseling there, they would be working with a supervised graduate level psychology student, and they offer services both to students and anyone in the community on a sliding scale fee. They do not accept insurance, and so it's a very nominal fee of $10 to $15 per session. And then finally, Women's Resource and Action Center. It's an institution on this campus, and so I wanted to also let you know about them. They also have typically 3 graduate level psychology students that offer counseling, again, under a brief therapy format. And that is free of charge to University of Iowa students. I also think that the Women's Resource and Action Center really has some awesome and incredible support and discussion groups, and so just going to their website each semester, and I've got some listed there of the groups that are actually going on this semester, and even if you note the second one there, Getting There, A Guide to Surviving Your First Year. So they really have some wonderful groups there. And then I just wanted to give this final resource to you. This transitionyear.org, I think, is a really wonderful resource for both parents and students. And so you just click on the appropriate little name tag there, and there is a wealth of information in terms of transitioning to college, and if you already have been diagnosed with mental health issues, how to successfully make that transition, and or even just looking at the symptoms that may arise during college and how to seek out help. And I think that's it for me.
Great. Thanks, Catherine. I wanted to talk a little bit about Student Disability Services, or SDS, on campus. And we're the primary unit that makes sure that students who need academic accommodations because of a disability are able to receive those accommodations on campus. We create a level playing field in the classroom. So we're about access at the post-secondary level, and that's a little bit of a difference from the K through 12 system, where the emphasis is on success and making sure everyone succeeds. Once a student graduates from high school and goes to college, the emphasis on providing access so that the student can rise or fall based on their own ability and effort. So we provide reasonable accommodations to students who currently demonstrate a condition producing functional limitation in one or more life activities, usually related to maybe cognitive issues. The biggest group of students that we work with would have learning disabilities or attention deficit disorders. The second largest would be students who have a chronic health issue, and the third largest would be students that have psychiatric or mental health conditions. We have 6 staff members, including exam service specialists and accommodation coordinators, and assistant director, and myself. Very often our students will receive additional time for their exams because of processing speed, and we are able to proctor those for most of the faculty here. So a lot of times the students will take their exams with us, and then we will send the exam back over to the instructor once the student has finished. Required readings in an alternative format is basically the same thing as books on tape. We take the textbook from the student and we make an electronic copy, and that copy allows the student to have their textbook read to them. And this is really helpful. We use a program called Read and Write Gold, and that is the conduit for having the textbooks read. And what it looks like to the student is it looks like a Word document where they're actually reading visually, but they're also hearing what's happening at the same time. So being able to encode information in 2 different ways actually makes learning a lot more effective. The program also allows a student to stop if they don't understand a word or a concept, to click on that word, and it'll pull through to a dictionary definition and a picture. In addition to that, it allows students to create study lists for their exams, to highlight and move different things around to write papers, and it's a great program. We believe in it so much that the university purchased a site license for Read and Write Gold, so everyone who's a university student gets that free of charge. Class notes is another effective accommodation. I think for our students, they either can listen in class or take notes. If they try to do both at the same time, they don't do either particularly well. And so having a copy of the notes provided after the lecture allows the students to relax, pay attention to what's going on, and to learn and interact with the instructor. Because disabilities impact students differentially, how you schedule your courses during the day are very important for our students. For example, a student who might have attention deficit disorder would not do well in a class that meets once a week for 2.5 hours. And similarly, if a student had a chronic fatigue issue, that would also be the case. We recommend our students not schedule courses back to back, because I think that if there's advantages of using the time in between courses to study, between classes to study, to get the notes out, to see what's going on in your next class, what you've been reading, and to orient yourself to paying best attention in that class. For students that are deaf and hard of hearing, we can provide sign language interpreters, FM systems, which work with a hearing aid where the instructor would wear a microphone, and the student would have the ability to have the instructor's voice clicked right into their hearing aid. For students who don't use sign language, we also have FM systems. An FM system broadcasts the lecture. There's CART providers. CART providers are essentially the same thing as a court stenographer. that in real time they will take captions of what's being said in the class. And this is helpful for a deaf student that doesn't know American Sign Language. And of course, we'll provide sign language interpreters as well. I want to talk a little bit about attendance. Attendance can be problematic, especially if our students have chronic health issues. The attendance statement accommodation does not allow the student to miss any more classes than is already indicated on the syllabus. So we can't overrule the syllabus, but what that statement provides to the instructor is the assurance that we have information on file that the student has a medical condition that could impact their attendance, and we want them to take that into consideration when they deal with any absences. And that prompts the student and the instructor to have a conversation about what are the instructor's expectations if a student's not able to attend class that particular day. For students who have learning disabilities, we're able to have them not graded on spelling or grammar on in-class writing assignments. And then finally, I want to talk about the world language substitution. If a disability prevents a student from learning a second language, and this could be for a variety of reasons, primarily learning disabilities, but also if a student has a hearing impairment, perhaps a student with cerebral palsy, we look at those individually and we're able to recommend to the College of Liberal Arts and Sciences and the Tippie School of Business substitution classes for the world language requirement. So high school and college are two very different worlds when it comes to disability. In high school, it's the responsibility of the school system to identify a student with a disability, provide accommodations, evaluate the student at no cost to the family. Because the legislation changes in the post-secondary world, the student in college is responsible for identifying themselves to our office and requesting accommodations, and to provide evaluation or documentation at no cost to the institution. Our documentation guidelines are available on our web page. For the majority of disability categories, we need something from an appropriately credentialed medical provider on their letterhead with a signature. For a learning disability, we do need a comprehensive testing battery that's no more than 5 years old or has been completed with adult norms, and in that case, age 16 and a half or older, that will never expire. So on our webpage, there's a 2-page application basically asking you to identify who you are, and then if you know something about your disability or accommodations that you've used in the past that have been successful, to let us know those as well. And once we receive that and the appropriate documentation, we'll go ahead and send the student a letter asking them to come in for an intake appointment. And at that point, they will be assigned to one of our accommodation specialists. They'll meet with that person at the beginning of each semester. And with the SDS staff member, they'll complete an accommodation form for every class. And that's how the student communicates to the instructor that they are a person with a disability and will need accommodations. And we work with the students to make sure that that process happens smoothly. The students are sometimes anxious the first semester they use the forms. It's all new to them. And we tell them that the faculty members see these forms every semester, and we'll generally make an announcement the first day of class what to do if you have an SDS form. This part is helpful. The form is something that the instructor and the student are, it's designed to have them sit down and have a conversation. And we do that intentionally. There are universities that will actually send the form to the instructor on the student's behalf. And I think what those universities have found is that very often the student and the instructor will never sit down and discuss the accommodations, and the student may not actually receive the accommodations. We want the student and the instructor to have a personal relationship, and the form is the conduit for them having a conversation about how to be successful in that particular class. Parents often ask me, well, what are the attitudes about the accommodations from the instructors? And I'd have to say the instructors have a really positive attitude about that. The average response from an instructor is, this is great, we'll make this happen. Is there anything else I can do to help you be successful in my class? And then we ask that the student keep in contact with our office if any problems arrive or happen with accommodations. We won't know if that's a concern unless the student tells us, and we're going to assume that no news is good news if we don't hear from the student. And final thoughts. It's important for the student to follow through. And I can tell you that every fall semester we have students who are qualified for accommodations. We've worked with them at orientation. We have everything in place, and we don't see them. They don't come in for the intake appointment. And when we talk to the student later, they tell us they just wanted to try it without accommodations and see how it goes. And how it goes is typically quite badly. Very often we'll see these students on the second semester spring semester where they'll come in, they're on academic probation, and they want to use their accommodations now, and they've dug themselves into a pretty deep hole. So what we suggest, and we're talking to parents and their students, is use every accommodation in every class for at least the first year or two. And if after that you want to try it without, and you come in with a solid GPA and an understanding of how college works, maybe we'll have that discussion. But don't dig yourself into a hole because you haven't used the accommodations that you're legally entitled to. Accommodations do not replace the need to study hard in college. They don't take the place of effort. And for a campus our size, students must be able to self-advocate. And that very simply means that the student can talk to the instructors about their needs, and that the student will let us know if there's anything that is a barrier to their succeeding.
So when thinking towards that realm of success and the awesome resources we have on campus, like Student Disability Services and like University Counseling Service, we do have students sometimes who are just not sure about being able to gain access to that. Sometimes there's a lot of resources, and figuring out which one makes the most sense or that they're even there is needed. And so that's where the Office of the Dean of Students, student care and assistance can come into play to really help provide that access and that knowledge and really that support piece. So as I mentioned, we do work to provide that support. So whenever students are experiencing situations that are really impacting their ability to fully engage here on campus, and that can be in the classroom or outside of the classroom, we're here to provide that support. A lot of times this may look like emergency and crisis situations, and you can see a list of different examples of what we work with. It's an unfortunate reality that a lot of times when we come to college, whether it's straight out of high school or return after some time away, that life still happens. And trying to navigate the campus while managing life is a lot, especially if we're doing it away from home for the first time. And so that's where our office comes in to provide that support piece. We definitely don't replace the role of family. That's a very important role. But again, just navigating that larger campus from being here physically with them and connecting them to different offices that might be of help. So like I said, those are some of the examples of ways we work with students or why we see them come up in our office. We're consultation and care, and that's the realm that we work for. And we know that we're not here to take over for counseling or to take over in the realm of student disability, but it's just that friendly space to be able to go to talk and to really help provide that support piece. So that's important to note. We also review and consult on different incident reports and concerns. Sometimes this may look like a phone call from a concerned family member. You might be picking up and noticing something that's going on. Maybe, unfortunately, there was a loss in the family and you wanted to make us aware of that. We're able to talk with you about different resources to share with your student, or we can reach out to your student too. And we work together to kind of navigate what that looks like in that sense. We also take reports from faculty, staff, friends of the students, others that they come in contact with, that when they notice that something might be off, that they might be struggling, we might hear about that, and we'll outreach to the student to see, do you want to meet? How can we assist you? Is there ways that we can help support you better to be successful here? That's really the ultimate goal. And we do have a reporting form on our website, so you can see the link listed. That form does have an anonymous option, and we do sometimes have folks choose to do that. And again, we will do the outreach based on that, and hopefully that student will want to partner with us because ultimately we're there for them. Another program that we've created is the On-Call Dean program. So what we found is that there are times that students go to the emergency room. Maybe they had their appendix burst, and that can be a really scary situation. I know I personally don't like going to the emergency room alone, and so I can't imagine potentially being an 18-year-old and trying to navigate that system. So we have an on-call dean, which is a full-time staff member and colleagues of ours that have been trained in responding to students and providing that assistance piece. That will respond to the hospital and check in with the student if that's what they would prefer. And this can be on a variety of concerns. So when a student is transported from one of the residence halls on campus, or the University of Iowa police respond and have received a call from their dispatch, our on-call dean is notified, so 3 a.m. on a Saturday potentially, and they will go to the hospital. And these are for more emergency situations that are not related to choices surrounding chemicals, like alcohol, for example. So this would be more so the medical side, like I mentioned, the emergency surgery. Maybe it's a mental health concern that needs to be considered more immediately. They're going to be there just to provide that support piece and to let them know, we'll be in touch when you look to return, how can we help you? Finally then, we also coordinate different efforts with campus partners on campus. One being the threat assessment and care team. They work collaboratively with our office whenever there's a kind of greater concern for safety for the campus community or for a student to really, again, provide that support piece. And the second effort then would be the early intervention team. The early intervention team is co-chaired by members from the Office of the Dean of Students and Academic Support and Retention. And it's a really great resource because it's a cross-disciplinary team that really focuses on student support and what does that look like. We know that often when students are experiencing situations that are impacting them, it's not just in one arena. It feeds into the other aspects of their life too. So if they're ill and recovering from a disease, a really bad cold, for example, probably worse than that. We know that can affect their ability in the classroom. It can maybe make their roommate situation difficult. Different things can come up with that. So that's the team that works together. On the screen you can see listed at the bottom different members that we have represented on the team to try to help, again, have that holistic approach. And we also coordinate our efforts too. So the student's not necessarily receiving 10 emails about the same thing, which can become overwhelming. But we're going to look to see who would be the most appropriate contact that can reach out and really help to assist that student. We're in the 4th year of the early intervention team and have served 389 students in the past year. As I mentioned, we do deal with a variety of concerns, and that does include mental health as well. College is a very stressful time, the transition here, and just really kind of navigating that new experience and that more independent phase of life can be difficult. We also know that some of our students come to campus with some concerns that may already be existing. And again, this is an opportunity for that team to help provide that support piece. So it can be mental health, medical, and academic concerns are different things that we address in our team.
Thank you so much, Catherine, Mark, and Nikki, for the great information. We're now going to move into our question and answer portion of the presentation. And so please remember, for folks who are attending this webinar, our presenters are unable to answer questions about the specifics of your student's experience, but can provide information that might be helpful in guiding your student. So if you have a question, please type it into the question box, and then we'll read the question out loud so all participants can hear, and then the presenters can respond. If you're unable to type your question and need to use the mic function, please use the raise your hand function so we can unmute your mic. If we're unable to get to your question during the webinar, we will follow up with you via email to make sure that we answer your question. So let's go ahead and get started, if there are any questions. Oh, there might not be today. Oh, looks like we have one. Let's see. So we're looking for some folks who came in a little bit late. Can we talk a little bit about what Catherine was talking about in the beginning around some mental health resources?
Yes, and so I did speak first, and so really what I spoke about was the mental health resources here on campus, and so that would include University Counseling Service, where I am the clinical case manager, and we offer a number of mental health services to students free of charge. There is no charge for our services. And then also spoke about the student health and wellness, where they offer psychiatric services where students can see a psychiatrist. They also have an eating disorder specialist on staff. And then there's Seashore Clinic on campus, and they also offer counseling to really both students and anyone in the public. That's different than University Counseling Service. University Counseling Service only provides services to enrolled University of Iowa students. But Seashore Clinic, students can seek counseling there if they would like. They would work with a supervised graduate level psychology student, and they offer services at a nominal fee of $10 to $15 per session. And then there is also the Women's Resource and Action Center on campus that offers individual counseling by 3 graduate level PhD students. And then they also have a wonderful array of support and discussion groups there. The Women's Resource and Action Center serves all students. So I think that's important to note.
So just as a reminder, we will post the recording of the webinar as well as a full transcript on our website. And so if anybody missed any portion of it, you can always refer back, and we have them on all year long. And so if you can't remember what you heard in November and it's March, you can always go back, which is nice. We have a question around if a student is in need of assistance but don't know who to talk to and not always comfortable asking for help, is there a contact name and number that she can call to use for assistance?
Yeah, I can jump in with that. This is Nikki Hodes from Student Care and Assistance. I think that's a natural role that our office plays with that, because sometimes it is hard to ask for help and assistance, and to recognize that and to feel comfortable to utilize it. And that's where we can come into play. We often meet with students who finally are kind of admitting, I might need some help. I'm not sure how to go and where to go for that. So contacting us, our email is listed on the screen right now, and that's checked often in our office. A phone call to us would work as well, which is 319-335-1162. And either myself or my colleague Angie Reams, who's the director for Student Care and Assistance, can provide help, just understanding a little bit more maybe about some circumstances, and we can even outreach to your student, which is something that's a bit more unique that we're able to offer. It is up for your student to want to seek out that assistance piece, but we can definitely try to connect with her. So please feel free to contact us.
All right. This one is around if incoming students were made aware of the transition year resources at the time that they started. So knowing what sort of information is given during orientation and maybe on Iowa and things like that. So I don't know, I might be able to help answer this question.
I look to you.
So I'll try to answer this. So part of the orientation process over summer is students work through a portion called Explore Iowa, and they go through each part of the Iowa Challenge. And they talk through, how to excel as a student, how to choose and make healthy choices. And so my office, Academic Support and Retention, we facilitate the Excel portion, and we talk a lot about the differences in care from high school to college. And so we do a large portion of that around continuing care. So if they have seen a counselor or a doctor at home, what resources are available for them here, as same as if they've received an academic accommodation in high school, how that looks different. I know that both the Dean of Students and University Counseling Service and our office are all available at all of the sort of fairs, and then Student Disability Services takes walk-ins during that time, and so we're all sort of available there. For students who might be having, there is an additional piece during the Success at Iowa course, which is a course that all new students have to take that talk about campus resources, and each one of our offices is covered in that. But if students are having a hard time referring back or recalling, sometimes there's information overload. I always say, like, Google is a friend, and so sometimes University of Iowa, stress will come up with both Student Health and Wellness and University Counseling Service. Disability will come up with SDS. So, talking about how do we recall those things, because they are given the information starting from orientation through sort of week 6, but we know that sometimes it might not always stick. So the more that we can address it with students, the better.
And that's, I think, the important role of when we partner with you all as family members to the students too. So for example, if you did come to a traditional orientation session here, you received, you may not remember, but a very handy yellow bag. And in that handy yellow bag were some of these resources. Because we know that students have information overload just as much as we do going through that process. And so for you all to be aware of that too, and to kind of help chime in with that, it's kind of that partnering piece, that assistance side of things.
Mark, there's a great question for you. So if a student uses an SDS form, is it noted on their transcript?
A great question. It is not noted on the transcript that the student used an accommodation form, nor is that information that the student is registered with our office on any university-wide database. So the only time a student would be identified as a person with a disability is if they self-identified with the faculty member in order to get the accommodations. It's not part of any kind of permanent record here, either within the university database or in terms of the transcript.
Great. So that is all the time we have today for questions. And so we thank you so much for joining us. Please know that all of our webinars are posted online at uc.uiowa.edu/family-resources. Our next one will be the first Friday in December, talking about managing the winter break transition. So when students come home for winter break, they might look and feel a little different than when they left. And so talking about how we can support them through that transition and support you all. If we were unable to get your question answered during the webinar, we'll follow up with you via email. And if you have an additional question, please feel free to send it to us at uc-retention@uiowa.edu for a response from a University of Iowa staff member. So we thank you so much for joining us, and thank you to Catherine and Nikki and Mark, and we hope you have a great rest of your Friday. On Iowa, go Hawks!